He is Dr. Brandon Trale. He is an orthopedic surgeon, Indiana Regional Medical Center, joining us today to talk about a very, very exciting development within the hospital. And I bet you it's all a buzz there, isn't it?
Absolutely, Todd. New technology at Indiana Regional Medical Center. We have the MAKO robot, which we use for robotic assisted total knee and total hip arthroplasties. Brand new at Indiana Regional Medical Center.
Conversation brought to you this morning by Marcus and Mack, a law firm representing injured people. We talked about robotic surgery previously with other applications, generally gut surgery and things of that nature, soft tissue stuff that we think about. This is entirely different, though, when you apply it to orthopedics, is it not?
Absolutely. The robot actually helps us to make very, very accurate cuts to within a millimeter and helps us to balance the knee so accurately that it's really, really difficult to do otherwise.
Mm-hmm. It's a really amazing. I've seen some pictures. I've not seen the actual unit. When you think about guys such as you who have been surgeons and have been used to dealing with very delicate instruments for your entire life, this is a whole different game. Tell me about the training process to get yourself up to speed and be able to be proficient at such a new technology.
Okay, so we went to a course in Atlantic City, and this was sponsored by the manufacturer of the robot, and it was a 2-day course there, so we got to scrub several surgeries with surgeons who were trained on the MAKO, and then we got to do what's called a sawbones lab, where we actually have plastic bones that we use the robot on to get a feel for how the robot works and how the instrumentation works. And after that, we actually had a cadaver brought in, and we did an actual procedure on a cadaver here at the hospital, to get a live feel for how the robot works.
Sort of like spring training.
Sort of, yeah. Yeah.
There are obviously going to be big questions when you deal with something like this, and the great advantages of robotic orthopedic surgery. Questions such as length of stay as opposed to previously, pain management, and if it's easier on the patient, and obviously something that you've already mentioned, the precision. Obviously, you would think that if you're having that much more precise movements within the body, then there's less of a chance of getting into some other area, damaging an area, or moving about and actually having contact with other areas of the body. This is really, really minute, isn't it?
Absolutely. The robot does have what are called safe stops. So when I'm using the robotic arm that's attached to the saw, it will only let me cut within the parameters that are designated by our preoperative plan. The patient has a CT done of the knee or the hip prior to the surgery, and then that goes into the program in the robot. And prior to the actual cutting of the bones, we have waypoints that we get on the knee to produce a real-time 3D image of the extremity in the computer so that we can manipulate that image, and I can make cuts on the computer screen and see what the result of that is going to be prior to cutting anything. And then when we finally have a knee, for example, perfectly balanced, then we make those cuts, and I know that those cuts are going to be very precise and within a millimeter of the parameters that we designated prior to the actual cuts. And then the robotic arm itself will not let you cut outside of those parameters. So there's very little risk to soft tissue components such as ligaments, nerves, and vessels that are surrounding the bone there.
Yeah. Let's stay there with the knee as our example.
Okay.
In the past, we're talking about complete open surgery. We're talking then about arthroscopic surgery. What types of procedures generally apply when you're using robotic surgery here?
So for the MAKO, we can do total knee arthroplasty, unicompartmental knee arthroplasty, which is a partial knee replacement, and the acetabular or the cup component of the hip as well. They have recently come out with an application to cut the femur. I'm not using that yet, but in the future, it's a possibility. As far as the knee goes, again, very accurate, much smaller incision. Mm-hmm. So I can do what I need to do through a smaller incision because I don't need to cut the knee all the way open to see all of the distal femur or proximal tibia. I can make my incision smaller. So a smaller incision generally means faster healing times and shorter length of stays. The preliminary data out on the robot does show that we do get faster healing times, less blood loss, shorter lengths of stay. I
would assume then that if you're getting to do less cutting, there's also less pain involved.
Yeah, I really have to defer the pain management to anesthesia. Some places do regional anesthesia. I know that's something that we've done at Indiana in the past, and we are going to start doing again here this summer, which is nice for the patient because they get a block, and really that extremity is pain-free throughout the entire procedure and for about 24 hours afterwards. Mm-hmm. And then it's easier to manage pain, once the surgical site has started to heal. And patients really ask for that type of anesthesia.
Yeah, and that's really, I guess, what I'm thinking about is in the recovery time. If you have to do less cutting, then that's less healing that has to take place in recovery, and therefore your pain ought to be better managed. Now, this particular system, the MAKO Robotics system, or robotic orthopedics as a whole, is that generally available in this region, or is it unique to IRMC?
It is unique to our facility right now. I don't think that anybody within a 45-mile radius has this technology. So it's great that we're able to offer this to our community and the surrounding areas. People don't have to go to the big city to have this done. They can have it done right here at our community hospital.
Yeah. Wow, what a big thing that is.
Yeah.
That's huge. And how many of the surgeons at IRMC are trained in using robotics?
All of us are trained in using the MAKO Robotics system. We've all done the course. And right now, I'm the only one that has actually done the surgery at our hospital. I know Dr. Bazowski has surgery scheduled. I think Dr. Wilson has surgery scheduled as well. I am doing a couple of knees the week after next. Mm-hmm. So, and I've had a lot of patients asking me about it. What's this technology about? Is this something for me? Is this something for everybody? And generally, we can use the technology on anybody. There are some exceptions, but a lot of times those exceptions would be exceptions to having total joint arthroplasty anyways.
Mm-hmm. Did it come easy to you when you got to Atlantic City and you started working on it? Was it something that you adapted to rather naturally?
I'm not a gamer, so everybody's like, it's like a video game, isn't it? And in a way it is. And the thing I had to get used to was taking my eyes off of what I was cutting and actually looking at the computer screen and seeing what the saw was doing on the computer screen. And once I could look at the computer screen and look down at what I was cutting and look back up and look down again, and I trusted the technology, I trusted the robot, then it came pretty naturally to me.
That's an interesting word to use. You trusted the procedure, you trusted the machine, and I would guess that as a surgeon who's been involved in this for a really long time, that's not an easy thing to do, to gain the surgeon's trust, and it seems like it did.
No, it wasn't easy to do, but I became comfortable with it. And I have to stress that there is no substitution for the skill, knowledge, and dexterity of a good surgeon, and that the MAKO is a tool in our toolbox. It's an extension of what we do. So there is no substitution for a good surgeon.
Yeah. Well, that's the real key to it. It's not as if you're not in the room and Lost in Space comes in, Will Robinson, and it does the surgery.
Right.
It's you in control of another instrument. It's just another, as you said, a tool in your toolbox.
Correct. And people ask me, well, what do? Wheel me in the room with the robot and then go get a cup of coffee? And I say, no, it's nothing like that. And that's the idea people have about robotics nowadays, but it couldn't be further from the truth. My hands are right there on the machine at all times. I'm controlling the machine. It really is just an extension and an augmentation of our skills, our knowledge, and our abilities.
As you have in your career, watched developments in orthopedic surgeries and the capabilities that you are given every time something new comes out, this would, it seem to me, be one of the bigger ones ever.
Absolutely. And the funny thing is I have a collection of old orthopedic implants, and I look at some of the stuff, and it's really barbaric, and I kind of scratch my head, and I say to myself, I can't believe that we did this to people 20 or 30 years ago, and now here we are using robotic technology and computer-aided drafting technology, actually, to do these precise cuts and get this super accurate component placement, and it really is amazing.
Yeah, I bet you. Now, you'll do this for a while, and then something else will come out, and it is a developing field, just as everything needs to be, and it's really exciting, I would guess, from your standpoint, to watch as these developments come along, and you finally get to do things like this.
It's very exciting, and medicine in general is always evolving, and as good providers and physicians, we have to evolve with medicine and keep up to date on new technology. And not everything is going to be a hit, and not everything is going to be, the next best things. Some new technologies fail. Some new technologies we find out aren't so great. MAKO's been around for about 10 years now. It's very proven, and I'm happy to have it here and offer to my patients in Indiana and the surrounding areas.
Yeah, it sounds like it's more than just a hit. It's a home run.
Yeah.
It's an amazing technology. You can learn more about it by going to irmc.org/MAKO, MAKO. And if people want to pursue this, if they've been told, you're going to have at least a partial or a full joint replacement there in that knee, that hip, whatever it might be, then they can obviously get involved in that process. And maybe if they've had fears in the past about things that they've heard about joint replacement, maybe this will ease their minds and let them understand that it can be a whole new life, can it?
Absolutely. And, we offer this at Indiana Regional Medical Center exclusively. If you're interested in it, you can go to our website, www.irmc.com/MAKO, to learn more about the robotic technology that we offer there. And if you have questions, you can always call my office.
Beautiful. Beautiful. Dr. Brandon Trale, thanks so much for coming in to visit with us. We appreciate it.
Thank you, Todd.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. Again, AM 1160. Again, AM